Member at large on the leadership team of the Society for Health Communication. I am also, in my other life, I am also co-founder and president of a company called Communicate Health. And I will be moderating this amazing panel this morning. And I'll start with some introductions. So let's see, I am a white woman. My pronouns are she, her, and hers. I'm wearing a nice gray shirt with some short hair, and I feel tempted to say I'm like dashingly handsome and very tall, but I'm actually quite short, so that's not true. But I'm going to pass it on to our other panelists to introduce themselves.
Hi, I'm Mark Miller. I'm the Vice President of Communications at the de Beaumont Foundation. I use he, him, his pronouns, and I'm a white male, brown hair, wearing a navy suit, white shirt, and cowboy boots that I don't get to wear very often.
Good morning, everyone. I'm Jamira Alexander, the President and Executive Director of a nonprofit in Chicago called Public Narrative. We work with community organizations and journalists, and we bring the groups together to help tell better stories. My pronouns are she, her, and I am dashingly beautiful and quite tall. And I'm really excited to be here and share more of the work that we do. I am wearing a black floral wrap dress, and I am an African-American woman.
Good morning. My name is Carmen Valdez, and I use the pronouns she, her, hers. And I am an associate professor in the Department of Population Health at Dell Medical School here in Austin, and also an associate professor in the School of Social Work, the Steve Hicks School of Social Work. At Dell Medical School, I lead the Division of Community Engagement and Health Equity, and our division focuses on populations in East Austin that primarily live on the eastern side of the city and that experience significant disadvantages in access to resources. I am a Latina, Hispanic woman born in El Salvador and came to the U.S. when my family fled a civil war. And I'm wearing a floral blouse with plum-colored pants and shoes that I love to wear because they're like very chic. But I am not tall. I am not tall.
It's not a prerequisite for the panel. Yeah. All right, I am going to get us started. So what we say as health communicators is very important, but how we say it is also important, and that is the topic of this panel. So many of us use tools like framing and storytelling in our work, maybe a lot of times in our campaigns or health education projects, but it's also important that we use it in our external communications, because if we're being real, we all are, wearing another hat these days, which is reputation management for public health and health communication. So I'm hoping that we're going to have some really rich discussion today on all of this. I'm going to start by asking each of the panelists a question or two, and then I have some questions for us as a group, and we will leave plenty of time for questions from you all, both in the room and online. So like a good health communicator, I'm going to start level setting with some definitions. So Mark, first question, can you talk to us about what framing is and why it's important?
Yes. Instead of trying to sound smart on this topic in terms of definition, I want to read the definition from the Frameworks Institute, because all they do is framing on social issues, and if you don't know them, you should look them up. But they define framing as the choices we make about what to say, how to say it, what to emphasize, and what to leave unsaid. And they say framing affects how people hear us, what they understand, how they feel and act as a result. And the reason that framing matters is because if you do it well, you're taking into account how people are thinking, feeling, what their past experiences are, and it's also flexible. I mean, I'm a communicator, like I'm a messenger. I love writing messaging, but really, whether you know it or not, there's a lot of thinking that goes into it before you actually create the words. And a recent example for us at the de Beaumont Foundation is we did a lot of polling about building vaccine confidence. And one thing I found, there was a lot of differences, as you can imagine, politically. And so I would see like, okay, Republicans say this and Democrats say this. One thing that really stood out to me is that Black Americans and Trump voters had one thing very strongly in common, which is they did not want to be told what to do. And so the framing that seemed to be most effective, and this is from talking to like community health workers on the ground, was saying, I understand you have questions. I want to make sure you have all the information you need so you can make the decision that's right for you and your family. And just twisting it that way as opposed to, here's all the reasons you should get vaccinated, was actually very effective. What was nice about that as a tool is we were giving people the frame that they could then tailor to their different audiences.
Thank you, Mark. Jamira, your organization is working to shift narratives around key public health topics, and I'm wondering if you can talk to us about what that means, shifting narratives, and what it looks like in your work.
Absolutely. For us, it really began with the stakeholders that we'd engage. Next slide. So in engaging these key stakeholders, we identified individuals from community, media, and academia. And not just, any organizations or institutions, but those who were truly aligned with the focus of our work. The project that we worked on together was the Chicago Community Media and Research Partnership. It was co-led by Public Narrative as well as the Alliance for Research in Chicagoland Communities, a stakeholder group out of Northwestern University. And engaging these organizations and these media outlets, it gave us an opportunity for us to really look at what are some of the prevailing narratives around public health that are really plaguing our communities of color, white-led institutions who are going into communities of color, doing research that is completely distant and separate from the true lived experiences of individuals. And so in facilitating that, you have to know that we entered this project in September of 2019. We had no idea that a pandemic was on its way. And when the pandemic hit, we found ourselves kind of scrambling to figure out, we're only about maybe 9 months in, we don't know a ton about the work even, of what we're even coming together to do. As much as we'd accomplished at the time, there was this notion that we needed to get on one accord and begin to share language. So journalists, of course, were invited into the researchers' worlds, and the researchers were invited into the journalist world. And together, we created a repository of resources that we could provide to our audiences to then help navigate the early stages of the pandemic. Again, still no instructions around what to do, how much to do, and so on and so forth. But what we found was there were a lot of diseases and or frailties that folks were really dealing with that we had to kind of structure language and messaging around. Everything from like what they might want to consider for their diets, particularly as it related to like any of the instructions and the guidance around social distancing that was coming from the city, state, and government. If you're familiar with Chicago, we are of course known as the Windy City, not because of the weather necessarily. So to find our politicians on one accord, it was really interesting to see how if you tuned into a press conference that the Cook County Board President held, the mayor or the governor held, the language was consistent. I don't know that I had ever seen that in messaging when it came from a government level. So this gave us an insight to what that looked like to be on one accord and how to structure that. Beyond that, we developed our framework, which you can show on the next slide, to really help folks understand how we navigated this project and what we came away with in understanding from other media makers. So it wasn't just the folks on the previous slide, but we engaged other media makers in listening sessions to understand if you're covering a story that has anything to do with heart disease or cancer or maternal morbidity, what resources are available, not solely resources, but what contacts or what sources are available to you as experts, so that these relationships, we can actually utilize these and allow them to fortify the stories that are being shared. From that, we developed a framework that allowed for us to focus on just how deeply community academic partnerships should engage journalists and to what extent. And so that's opened up this thought that there is, of course, a deeper need for capacity building for journalists as it relates to health reporting. But in doing so, there are outlets and organizations who will focus particularly on creating the bandwidth for that, and public narrative, of course, being one of those.
So I think what we're hearing is that, there's different ways to frame a message, to shape a narrative. There's different ways to tell a story. Dr. Valdez, can you talk about your work using photo voice and the impact that it's having?
Absolutely. So I think we all agree that storytelling and narratives are very important in capturing people's lived experience. But researchers, and I'm one of them, often the way that we think we're capturing stories is by interviewing people with prompts that we believe will get to the heart of the matter, and then we take people's answers and we interpret them according to our academic training and knowledge. And in my team, I have a team that's working on an environmental justice project in Austin and in the Rio Grande Valley. And we wanted to flip that around completely. So instead of us bringing in the topics, the themes that we wanted to elaborate on with participants, is we equipped young people, high school students, with their own phones and the cameras on their phones to capture what environmental justice looks like on a day-to-day basis for them. And I mean, I'm assuming most of you are familiar with photo voice or know what photo voice is, but in the most simple term, it's just capturing through photography a situation that is part of people's lives and that affects their health or affects their well-being in one way or another. And so it's one of the benefits of photo voice is that it's accessible because people already have cameras. It's about the day-to-day spaces that they already occupy. But the largest or the biggest impact is that because it raises awareness of an issue, it can also be mobilizing. So usually we start with a workshop or a series of workshops with youth where we frame the issue and we provide a historical framing of environmental justice where they live. And then they discuss how that affects their lives. And often it's the first time that they're thinking about these things, right? It's like they're walking down the street and the sidewalks either are non-existent or there's no shade, but they haven't really thought about it because it's their day-to-day life, right? It's what they know in their community. And so the framing allows them to gain awareness of those issues, and then they start taking the photographs in a very different light because now they understand what that photograph is capturing. And then afterwards, they work on writing narratives about what they see, and this is what's called the showed method. So what they see, what is really happening, how it affects their lives, what can be done about it. And then that knowledge gets displayed, they report it out, and the information that's gathered from it is actually taken up by a coalition that will act on those issues. So this is just an example of how you can really change who tells the story and how the story is told using this method.
Can I follow up on that? Because I know you have a photo, an example here, one or two, if you can tell us sort of about these photos.
Yeah, so in the previous one, after we did the framing, we engaged in what we call appreciative inquiry. So we asked them, what are the places in your life, and this was done in the Rio Grande Valley, so what are the places in your life where you can be yourself? And they talked about parks, about a beach, about open outdoor spaces. And then we asked them, what makes those places special to you? And this is in the Rio Grande Valley, it's predominantly Hispanic children of farm workers in many cases. And so they talked about, well, that's where my family goes to on Sundays. That's where we go and we can play basketball with our friends. And they talk about those issues. And so then we say, well, what could make those places better for you and for your community? And they come up with ideas of access, safety, comfort, and joy. And so then we went to the park with them. We created subgroups. One was going to focus on access, one was going to focus on joy, another one on comfort, and they took those photographs, and in the previous slide, they actually upload those slides, and you can see how the things that they're capturing, and a lot of what they're capturing is not just a situation, but an experience, right? Like the photo of them, huddling around together and having fun, and so that's an example of how then they start creating these narratives based on that.
Sharing. Those are great. Now I'm going to pose a question to all of you, which is that language is a key piece of health communication, and I know that all three of you have spent a great deal of time reflecting on the language of health and public health, and I'm wondering if you can talk about how we can better align the language of health professionals, community members, researchers, journalists, a lot of these different stakeholders that we've been talking about. And anyone can jump in here.
Sure. So one of the things that we found helpful was in, creating a glossary of sorts. One, in engaging these stakeholders, of course, and getting their feedback, developing a series of questions that would allow us to extract what their own keywords and what they might be synonymous with in another industry. In doing so, and then having allowing them to have conversation among themselves to really understand the context of that language. But in capturing all of that, I mean, you all are familiar with research, so there's tons of information. But being able to synthesize the information was something that our project leadership team did to make certain that we didn't lose the attention span of the journalists. As in addition to that, we kept the researchers engaged, understanding the rigor of their work. So it's definitely a process that has to be well thought out, but even allowing for trial and error, certainly setting norms going into the engagement overall, but being able to check in regularly and call each other in. I heard that in one of the sessions yesterday, being able to call each other in versus calling someone out because of, a misinterpretation or, poor delivery. And this is something that we're all navigating together. And I think that really stood out in this process, certainly as the pandemic hit, that how do we pool our resources? And even recognizing that though our project may take a different turn, so it's important to note that the institution that funded the project, the Patient-Centered Outcomes Research Institute, of course, PCORI had a ton of check-ins with us, just as a standard practice for the project itself and the funding, but the flexibility of the institution was also very much so needed because, of course, the original submission didn't include as many pivots as we needed to make. So being able to be flexible and very nimble with one another was very helpful in identifying that language, but of course, synthesizing that information and providing to the task force the information that, we all found useful and of course would keep the attention span of the journalist was most important.
Go next. So that's something that I think about all the time in terms of how to better align priorities and the language that's used. And I think we need to start by acknowledging the power differential that exists between professionals, academics, and the communities we want to work with, and step aside, let them speak what they need and and how that should come about. I have a colleague who is he's the president of a nonprofit here in Austin, and he always says, even if you think you have the answer, wait until you're invited. And I really like that. It's just often just step aside and let people explain what they need. But also, so some of what we do in my division is that we coach community academic teams on how to work together. And that basically means not just what kind of tools you can use, like photo voice, but how to establish trust and how to maintain trust as the foundation of the work that's going to happen. Because we know that there's been a history of mistrust, and rightly so, between academic institutions and their local communities. And so really focusing on developing that trust and the relationship that is where the data is shared, where there are agreements ahead of time of how the project will be implemented, who will be at the table, I think can go a really long way in aligning messaging.
I would add that I've been doing communications for a long time, but I'm relatively new to public health. I've been doing in public health for like 5 years. So I still consider myself sort of an outsider. And there's this great book by a former scientist turned Hollywood writer, and the title of the book is Don't Be Such a Scientist. And I think one of the things is that people, it's easy for public health people to say like, oh, community members need to bring us to the table, and they need to understand what we do, and if we only told them. But I think that public health people need to be able to be open to speaking in different ways. So if we, people in this room, do research and say this is what's going to work, they have to listen. And so my advice to you is to keep pushing for what you know will work. And I think one thing my boss says is too often in public health, the question is like, do you want to be right or do you want to be understood? And too often the answer is we want to be right. And so I think it's our job to say, like, what change do we want to see, and what's it going to take, and that affects language as well.
Great points. I'm going to switch us over to talking about a topic that I love, which is empathy, and I think it's relevant to this conversation. And I'm wondering what you all think is the role of empathy in health communication, and how communicators like the folks in this room and online can use empathy more effectively in their day-to-day work, and sort of what that looks like.
Well, I'm a psychologist by training, so empathy is a word that, or a term that I've studied a lot about. I think empathy is necessary, but it's not sufficient. Because we can empathize with somebody's experience and still do harm in trying to help them. And so in the question that you prepared for us, it actually, you had empathy and solidarity. And so I really feel that solidarity is more important than empathy, because empathy, again, can be top-down, can be more like sympathy, and we could still harm people through empathy by thinking we know what they need and that we can help them, right? And so I think solidarity is a better word, because it implies that you are there to support when invited, that you are there to listen and to understand how and whether you can lend a resource. But so I I like solidarity more than empathy.
We know that, in media and journalism, if it bleeds, it leads. And communities know that and they feel that. And the examples that, we have of harmful narratives oftentimes is someone else's story. When I think about empathy in journalism, I immediately go to compassion. There is a way of covering a story and doing, your due diligence without exploiting someone on one of the worst days or around one of the worst events of their lives. And sadly, when you look at a lot of Chicago's own narrative around, its own history of violence, you don't see one that shows community members coming together and working together to be a part of a solution. Being able to, that's one of the reasons why, though I studied journalism, I did not pursue a traditional career in journalism for that one reason. The technology of it is great. The relationships built are great. But if those things aren't being leveraged for the betterment of the subjects of those stories, and being able to give folks options that, they can make an informed decision around their health care or other major life-changing decisions. And that was the nature of, being able to lean into relationship building among researchers and journalists, that not only journalists, they catch heat all the time, researchers catch heat all the time, but to create a space for them to come together and kind of share some of their pain points as well as ideating possible solutions for moving forward. I think that is one of the clearest forms of empathy, solidarity, and compassion that allow for us to really, explore a future in health communications that truly involves community members. And it's not just something that we talk about, it's not nuanced, but it's something that's practical and it's tangible for us.
I wanted to add that we all bring biases to our work, and it's easier to have empathy for some people more than others. And the interesting work we did around COVID and vaccines, we hired a Republican consultant named Frank Luntz. Are any of you old enough to remember Frank Luntz? So Frank Luntz is a very famous consultant and pollster on TV a lot. And there was a discussion on Twitter about, hey, people aren't wearing masks. There seems to be this political divide. We should get a bunch of science communications people together and figure out how to talk to conservatives. And my boss said, well, we don't know how to talk to conservatives. We should talk to someone like Frank Luntz. Frank saw that tweet, and then all of a sudden we were working together. It was just really enlightening understanding how people perceive the world, perceive government, and it was very important because it was what we learned from that work also applied to other groups that were hesitant about vaccines. And so I think that it's something that what I saw that I realized that we don't fully have equal empathy across the board is when people on Twitter were saying things like, well, if those Trump voters don't want to get vaccinated at this point, we should just let them die. And it's like, well, you're a public health person. And as my boss said, if we're working in public health and there's an outbreak, some kind of disease outbreak at a Klan rally, our job is to go and deal with that and help people be as healthy as they can be. You don't have to pick up their literature. You don't have to sign up for their mailing list. But empathy really needs to be applied to the public when you're dealing with public health.
Those are great points, and it's just making me think sort of a follow-on question, thinking about solidarity specifically, and you touched on sort of our political polarization, Mark, and I think also the other topic that everyone is thinking about right now is misinformation and disinformation. And I'm wondering if you have any thoughts on how we might be able to use empathy, but specifically solidarity, and addressing some of these very real challenges right now.
There's an organization I was talking to about misinformation work, and what they do is they actually go into communities and sort of assess your relationships about who do you have relationships with, who should you have relationships with, because so much of misinformation is creating trusted messengers. And so their primary work in dealing with misinformation as a consultant is to help them leverage relationships. So I think a lot of it has to do with who's talking on behalf of public health people and other leaders.
For us, we developed, and this has been in utilization for a number of years, but we just relaunched it last week, the Chicago Media Guide. And we utilize the guide as a tool to connect folks who are looking, of course, to be published in media, but also as a starting point for establishing relationships with folks in the Chicago media landscape. In doing so, it's one of those tools that allow for people to really curate their media diet and make certain that the information that they're sharing is factual, because we know that the sources or the folks who are in the guide are ones who vet their sources. They are credible messengers. And in addition to that, a lot of the communications trainings that we facilitate really educate folks around becoming trusted messengers, not just for their own messages, but even those that they, curate and share beyond their networks. It's really interesting. Whenever we do our workshops with young people, we ask them, like, where do they get their news? And instead of them mentioning an outlet, they always mention a platform, be it Twitter, Facebook, YouTube. It's really interesting how time has shifted in such a way that our known credible messengers in the form of media outlets are not necessarily known as such. And so how do we help to preserve some of that? And I think it comes from the relationships that are held in recognizing that we live in a time where any and everyone is an influencer. It is not relegated to any particular social class. If you have a smartphone and you have access to this technology, you are indeed an influencer. But how do we not only create trusted messengers, but credible influencers that are sharing credible messages? And I think that comes with a deeper responsibility and accountability that I can't say that we've exactly cracked how to get folks on board to really pushing messages that help to advance public health in the way that we know needs to happen. One of the things that we've ideated with another health institution in Chicago was how to rally around social influencers and utilize their platforms. We've identified how to tap into relationships with journalists, but how do we reach those folks who truly do it for the gram? Right? And with respect to the way in which they move about the world, but recognize here is something that you could offer your platform. But at the same time, as research receives billions of dollars in funding, how are we then allocating portions of those budgets in the form of ad dollars? Because ultimately that's what it translates to. So thinking outside of the box for sure, and staying outside of the box, because of course the world is ever changing, but making certain that our industry, of course, grows with the technology, but not only that the relationships are sound. And I'm not 100% sold on the quality of our relationships moving forward, and that's something that I want to continue to really tap into a bit more, because I appreciate being able to connect with you over email, but to sit side by side and have a dialogue is a whole nother opportunity for deeper engagement.
Thank you for that. So when it comes to narratives and storytelling in public health, there are some critical considerations that I think it's important to raise. One of them being whose stories get told and who gets to tell those stories. And I'm wondering, how can health communicators help amplify community voices? We've talked about that a little bit, and ensure that we're centering equity in our communications and really thinking about those questions of whose stories get to be told.
I can start with just a really tactical solution for that, is that we sometimes get calls saying, I want to talk to a local health official about X topic. And anyone has the information, but some of them are media friendly and some of them aren't. And so a very tactical thing is finding the stories you want to tell, the organizations that have those stories to tell, and then helping them become good spokespeople. Because being a great advocate doesn't necessarily mean you're a great spokesperson. But if you can find those people, train them, I think that's a really good investment that will pay off in a lot of ways, not just for media, but other speaking.
To add to that, this is just like a shameless plug. So that's exactly what we do at Public Narrative. Yes, we facilitate. You did. I would be a fool not to take the opportunity. But we facilitate communications training, and we've done so for nearly 35 years. In doing so, we help folks to recognize the story. So we're entrenched in our work, right? Day to day, we have caseloads, we have projects or whatever, but you also have stories, and there are different stakeholders who can share some of those stories. So be it a story about triumph or overcoming, or you got a fundraiser coming up or whatever the case. Oftentimes, being able to tap into whatever your overarching goals are for the year, and then extracting stories from the folks who engage with the organization, being volunteers, all the way up to your C-suite leaders. And so in that, what we really carve out is a lot of fear that folks have for talking to the media. We're very clear with them, nothing is off the record. So as warm and fuzzy as you might get with the journalists, be very careful of what you share, because you do, of course, want to control your narrative. But the thing that I really challenge them to look at in the spokesperson training is to identify 4 questions that you are terrified of being asked about your work, and develop a response to those, and stick with those. The other thing that is really crucial to this in being able to represent our work effectively is also having a set of standing talking points. Yes, you can prepare for an event, on a case-by-case basis, but even if you had, I develop annual talking points. I know this where we're not shifting from what we've set for a full calendar year. I have a set, number of talking points that I stick to, and I can add and modify those as we go through the year. But for the most part, my word cloud, which I visually can see it in my head, my word cloud doesn't change because of being ingrained in the work. So just in helping people to begin to, one, overcome that fear of communicating with journalists, but also trusting themselves that you are indeed the expert in your industry, in your field. And it's not to say that there isn't much to learn and much to gain, but there's also much to share from the vantage point that you each have as health communicators.
I actually wanted to give you an example of the risk of us telling stories on behalf of people. And so if you can go to the slide, the next one. Oh, no, I'm sorry, one more, there. So as a researcher, I often think in fragmented ways, right? My project is about environmental justice, and so my interest is in how young people spend time outdoors, what happens when their neighborhoods flood, et cetera, right? That is a fragmented story. When we send our youth to take photographs, one of them came back with this picture. And we were talking about it in our small group, and she said, this is a field that we could spend time in. It's in my neighborhood, but we don't, because gangs usually meet in that field, and there have been drive-by shootings, and there's a lot of arguing that happens, and so it's very dangerous. That's why we don't spend time in that field. She said, there's a house next to that field, and an 80-year-old couple lives there. And so we don't visit with them because it's too dangerous. But we also wonder what it's like for them to live there, right? And then another teenager in the group said, Miss, they called me Miss, like if I'm, like their teacher, right? Miss, the other thing that happens here is that there are no sidewalks. And a couple of years ago, somebody I knew was hit and run. There was a hit and run, and he died. So we don't even, our parents don't let us come to this street, and there's really no way to even get there because there are no sidewalks, right? And it's too dangerous. And another teenager in the group said, the other thing, Miss, is that often on that street, cars race in the middle of the night. And we wake up at 3 in the morning, even though we don't live on this street, we wake up at 3 in the morning because of these car racings that happen in our neighborhood. And somebody else said, plus, this is a field, remember, this is in the Rio Grande Valley, right? This is in the city of Pharr, P-H-A-R-R, which is half a mile away from the border. Said, plus, this is a migrant crossing. And when migrants are crossing, Border Patrol is in the area, and everybody has to stay indoors. And when kids are in school, they go into lockdown if Border Patrol is in the area pursuing a migrant, right? So this is an example of how I could have never told this story because I don't live there. I don't have that experience. And I went in thinking I was going to learn about environmental justice, and environmental justice is just one aspect of their lives that they have to deal with on a day-to-day basis. So I just hope that this example shows the intersectionality and how it is experienced in ways that we could never understand and never communicate to others. And so the more we do this type of work, I think the more equitable our communication can be.
I think there's so much power in that too. I think some of what is coming across, it's making me think about just how important it is to make people feel seen and heard, and how that's just a critical part of our role as health communicators, and how much more effective we could be if we could start there and use our voices to do that. So I'm gonna be conscious of time here and switch a little bit to say that, in many ways, the story of public health during the pandemic was not a positive story. And I think we have some opportunity to change that. I think we're starting to change that. I think some of the conversations that we're having today are part of that change. And I want to ask, what story do we want to tell about the future of public health? And follow on to that, what advice do you have for all the health communicators who are in this room and joining us online about how they can help maybe change that story of public health?
I would say both advice and how to change it would be to find the positive. I think we're a lot better at talking about problems than solutions, but if we can tie our work to a regular person's hope and dreams, it's going to be more effective. But the advice I would give is, I know you all can probably relate to this, whether you have clients or internal clients like I do. It's often easier that they don't really want you to edit their stuff, right? So they're coming to you, and it's a lot easier sometimes to kind of let something go. So I feel like sometimes one day I'm speaking on a panel about clear communication, writing a blog post, and the next day I'm signing off with something with jargon and buzzwords in it. So I think that conferences like this are a time to kind of recommit to sort of fighting for what's right in communication. And I would just say, think about the social cause that you care most about and apply that same passion to your work in health communication.
I would say look at what you have to leverage in advancing equity. The conversation, we talk a lot. We, have all sorts of conversations around what that looks like, but not enough examples, not enough firm examples, and not enough examples from the perspective of the end user of our efforts. So being able to extract the stories and, involve community members who are deeply impacted by our work, not just in practice, but also even in our decision making, I think is a very powerful, next step. Particularly because there are folks whose lives will impact who they weren't invited to this conference. This conference is not for them. So I'm always mindful of who comes with us in the room when our presence is there. So being able to take this experience to our audiences I think goes a very long way, that can help to not only educate them by tapping into the dialogue in whatever, way they can, but also in thinking about, and I'll give you an example. When we entered this project, there was a community partner that had an expo, and the panel was talking about, different resources and things that were available throughout the state. And there was a gentleman there who was, if you're familiar with Chicago, the expo was around 63rd and not Halsted, 63rd and King Drive. And it's not the best neighborhood, but it's also not one of the worst in Chicago. And he said, he and his family had the information that they were sharing on that panel, that his mother would still be alive. And that really struck me, because to learn that research sits on the shelf for nearly 17 years before anything happens, and this is an individual whose family could have benefited from that information, it only fortifies the charge to be able to communicate the findings of these projects effectively, as well as providing for folks practical next steps. So, opposed to simply being able to check a thing off of our list, let's be certain that what we're checking off of our list is something that, really helps people to sustain in their daily lives.
I guess what I would add is that in many ways, how public health was communicated during the pandemic was negative, and it was necessary, because the public health system did favor people who had job protections, who had health insurance, who could work from home, and disfavored, if that's a word, those who did not, the frontline workers. So it was a broken system, and it's not that the pandemic broke the system was broken way before the pandemic, but the pandemic just made it very clear. And my hope is that that negative view of the public health system will turn into change. And the other thing that I've heard is that, on the one hand, healthcare providers are dropping out of those fields because of burnout, but my hope is that public health, maybe not necessarily direct service providers, but public health professionals are actually going to increase because of the pandemic. And the more we can bring in people who are from those experiences of not having insurance, of not having job protections, et cetera, into our public health field, I think that gives me optimism for the future.
Ending on a positive note. This has been really great. I want to thank each of the panelists for sharing their perspectives with us. And I would love to open it up to questions. We'll do the same thing as before, so we'll use the mic in the front of the room. Don't be shy.
So first I was going to say, I worked with Frank Lutz when I was at, yeah. He's a character, so I worked with him briefly at McDonald's, and it was actually for the same reasons. It was like to have him do a series of focus groups that was around understanding perspectives of people that, I'll just say, that don't think like me. So there's that. So I was going to share that. And then related to what you shared, I think that as those of us that are doing health communication research and practice, I think we want to be right and understood, right? So I wanted to hear from you, or any of you, like any recommendations that you have around framing. Actually, let me even put it like this: priming, agenda setting, framing messages in order to be right and to be understood, if that makes sense. It's more to be understood, but we want to be right.
Yeah, I want to clarify that. So we need to be accurate, but I
Yes,
think sometimes
that's true.
scientists also want to be thorough and include every single thing. yesterday I had a call, we're doing some work with Soledad O'Brien, and she was saying the problem is you get, an anti-vaxxer saying there are no safe vaccines. People die from every single vaccine, so therefore they're not safe. You ask a public health official, are they safe? And they'll say, well, they're 99.6% safe, which says they're not. So it's a matter of understanding how people hear things and being able to say things like, you're more likely to die from X than a vaccine, just talking in real language. So it's not, you're right and
understood. No, but that's very helpful. Thank you. Appreciate it.
All right, I'll ask a question back here. We spend a lot of time in this room thinking about kind of public health and storytelling and framing. Are there any other fields that you look to see how people are doing that storytelling well, whether it be environmental issues or what other places do you all go to look for lessons learned and how people can do this well that you think we could steal from?
So one of the groups that I look to is the Communications Network, ComNet, and I focus. So ComNet, and then I focus more so in the messages that they communicate around DEI. And then I kind of scour the internet, mostly LinkedIn, for other DEI professionals and their feedback and their thoughts and ideas to just compare. And then of course, I look to, if they're a consultant and they list who they consult for, I look at that institution or that organization to see what has been their track record. So I'm not looking to the professional to give me their report card. I want to create the metrics around measuring to see just how effective that is. And then I, tune in a little closer. You can almost kind of say stalk from afar, just to see when tragedy strikes, how do they respond to this? Are they putting out a message? I know when events have happened over the last 3 years, our board of directors wanted to put out a statement for every single thing. And in fielding our audience, they're like, we don't know you all you just do the work. We don't know you for putting out statements So just in kind of understanding the tone and the tenor of the organization, but also the communication network and then other professionals in those industries.
In terms of other professional fields, I would say education. So education, I think, is maybe a little bit easier, but it's all about, storytelling to me is all about finding a person who was affected in some way. It could be good or bad. So that person who lost their mother, that's very powerful. And I think education, instead of saying X% of people who go to preschool graduate, you can tell a story about a person who had that opportunity and what they're doing now. So it's a little harder, but I think we all have to look for the stories of individuals and individual communities to tell.
And often I steal from sociology. There's a great tradition in sociology of ethnography, of storytelling, and I will look for books that are published by sociologists that use those methods and learn a great deal. There's one book that's called Weapons of the Weak, which is an amazing book about how social class relations and how people negotiate them, and so the author calls them weapons of how ways that people that are in the underclass negotiate dignity and access to resources. So that's a sociology book. I also agree education is a great field, and especially sociology of education. Those are some. And then lived experience in general, I think you can look to psychology for some of that, but I think sociology mainly in education.
Right. And maybe one more from the chat. I think will probably get us to the next panel. So we have a question here. Do you have any advice for leadership of agencies who are fearful of doing public narrative work or counter-marketing after the backlash of the pandemic?
A softball question.
Well, I mean, this is going to sound just kind of matter of fact, but don't be afraid. I think if you identify what you're afraid of, and I go back to like framing those questions of like, what are you most fearful of being asked? And then working around that, but also gather your credible messengers, like, you know, what stakeholders in your city or your area, who are folks that have the receipts. Don't just gather people to have, you know, any type of engagement, but being able to look at what you as an organization, what your organization has that you can leverage, and without drifting away from your mission. I think that is one of the things that really helps in identifying narrative. And then also do a series of focus groups to understand like what is your audience interested in when it comes to like tapping into shifting public narratives. One of the things that we developed was our narrative change model that takes us through this whole process of, and it literally was derived from the theory of change, takes us through this process of understanding who are the stakeholders we want to engage, what do they lift up as a needed next step, what type of workshops or events do we need to plan and program around that, what stories can we connect journalists to for those getting published, but then also how can we leverage those stories for advancing public policy? And that, of course, could impact education, safety, or health. So just in thinking about like, how do you leverage the network that you have? And that's a big question, but in recognizing that we may not have all the answers in our time together, but we are gonna commit for a year, 2 years, whatever the time frame is, to then identify how do we move, and then what prevailing narratives are we gonna focus on? Certainly not addressing everything that impacts, but what are we gonna focus on? How much time are we gonna commit to that? And then being open to what the group decides is needed in moving forward.
I agree with that, but I want to add that the fear is real. That basically, you know, if you're going to be out there, especially if you're dealing with things like misinformation, you should almost expect to be attacked online or maybe otherwise. And so it's just important to sort of outline what those possible scenarios are and be prepared, like what if this happens, what if that happens. One of my favorite health officials early on, I think she was in Columbus, Ohio, she was giving daily plain language news conferences, really doing a great job, and actually wrote a blog post about how she was doing such a great job. And she left after people started showing up on her lawn and publishing where her kids go to school. It just wasn't worth it for her and her family. So I think it's important to recognize the political climate and the potential for that. On a positive note, though, so on a positive note, in terms of all the harassment and everything we talk about, we've been doing some polling about familiarity with your local public health department. And so if you look at CDC, then state, so local, the closer you are, the more people trust. And the level of familiarity was something like 60, 70%. But among the people who actually knew their health official or knew of their health official, the favorability was like 80%. So these things are not the general public, but a small vocal minority. So I think it's important to kind of keep that in context too.
Thank you. Thank you for swinging that around. So we are out of time. I want to just thank, again, our panelists for sharing their perspectives today. This was really enriching, and I definitely got a lot out of it. So thank you for your time.